Hello, everyone. Welcome back to your anatomy lectures. Today, we're going to be taking a look at bones of the leg mostly, but also a little bit about the joints between itself, like within it, but also at the ankle as well. So let's go ahead and take a look at what we have here with mostly like stuff regarding the leg and then a little bit of the ankle as well. So we're going to be starting off by looking at the leg bones themselves. And if you look closely, we looked at the thigh and the hip already. So this part is all done. But then you also have this part down here, oh, not that, here, which is going to be between the knee and the ankle. So kind of like how we looked at the forearm, you can see that there are two bones here. In this case, it's not radius and ulna, but it's going to be tibia and fibula. So tibia and fibula are going to be the bones in the leg, and kind of similar to what we saw in like the elbow and the forearm. There is going to be like one major plane of movement, which is like in the sagittal plane, but then there are also a couple of rotational movements as well. And although we'll talk about these later, you'll see that in the foot, there is a similar type of organization as well, which includes, instead of carpals, we have tarsals, metatarsals, and then phalanges. So let's look at our first bone, which is the tibia, and the tibia is otherwise known as your shin bone. So if you feel your leg right now, like you can feel that you have this really big, sturdy bone, that is the tibia. So the tibia is the one that you've often probably hit, like on a coffee table or otherwise, but this bone is very strong. Like, I mean, it hurts a lot, but it can take some damage. Like this is near the bottom of the body. It is bearing a lot of weight. So this bone is going to be very sturdy. So you can see that it's pretty thick, but also just to start off with, what are some major characteristics that we can see regarding this bone? So to start, does it have a ball end? Like for sure, no. Like you do not see that big rounded circular part. So this is not a femur or humerus, but you can see that this is a pretty thick bone, which has these two kind of smooth surfaces on the top. And then there's also this relatively big bump at the bottom as well. So let's go ahead and start looking at this. And before we actually kind of like look at some specific things, look at how it's oriented between the two bones itself. So this does not show it very well. So let's look at the last slide. So if you look closely, this is actually a right foot with the big toe over here, meaning that this is the medial side. The tibia is always going to be on the medial side. So the big bone is on the medial side. The other skinnier bone is on the lateral side. So this one, like whenever you think about like the tibia and its position and its landmark sometimes, think medial side. Now that brings us to our first landmarks, which are up here and here, which are going to be called the condyles or the medial and lateral condyles. And if you have a foot, that's pretty easy to figure out, but let's also look down here really quickly to the like end of the list. And you can see that you have this pretty big bump, like this little kind of notch that's coming off of it. That's called a malleolus. So if you feel the medial side of your ankle, you might feel like a big bump. Like I've always wondered what that was and why it's there, but that is going to be the medial malleolus, which is going to be helpful to tell us which side we're on. So this is the medial malleolus, meaning that this bump over here on the front, or sorry, medial front side of the tibia, that's the medial condyle. And then if you look on the opposite side, you have the lateral condyle. In a similar way, you also have these two kind of like articular facets up here. So you can see it a little bit better from this surface. These are going to be the medial, because medial or medial malleolus, medial and lateral articular facets or articular surfaces. So that is where the condyles of the femur are going to be able to kind of like rest on top of so that they can actually articulate a lot more smoothly. Now, if you look in the middle here, you can see that you have these kind of like ridges that go a little bit upwards. And in the same manner, which side is which? If this is medial malleolus, you have medial intercondylar, like tubercle and eminence. and then medial intercondylar or lateral intercondylar, like tubercle and eminence. So for the most part, these are going to be the intercondylar tubercles, but then in the middle, you have the intercondylar eminence mostly. So you can see those up there. If you look closely, like looking at that lateral condyle, you'll be able to see that you have this region slightly anterior to the lateral condyle that actually does have its own name, which is called Gerdy's tubercle. So Gerdy's tubercle is going to be one of the places where the biceps femoris is going to attach, and that's going to be slightly anterior to the lateral condyle. Now, looking at the front of the tibia, looking kind of like on the proximal side as well, it's not super clear, but you might be able to see that you have this kind of bumpy, rough region. This is called the tibial tuberosity. And most of our tuberosities, like the deltoid tuberosity, like that is going to be where something is going to attach. And there's something that's really important that's like attaching from your thigh down to your leg. Like that's going to be your patellar ligament and technically like your quadriceps tendon as well. So this is going to be the tibial tuberosity, which is where all of your quadriceps are going to ultimately lead to so that it can help with extending the leg. Now, looking at the shaft of the bone, there isn't a whole lot of distinctive things except for one in the very front. That is going to be called the anterior border or the anterior line. So if you feel the front of your shin, that is your anterior border. And that one is really important because like that's kind of the front of your shin, but that also does divide up like your surfaces, which give you your medial and your lateral surfaces. And then a little less, I don't want to say less important, but less prominent, I guess. You do have a medial and lateral line, medial and lateral border, which are going to then help with forming the posterior surface over here on the back. So if you look on the back, though, you might also see that there's a line that goes across right here. This is called the soleal line. And we'll look at this in lecture at least, but in lab, we did talk about this because in the back, in one of your deeper parts of your calf, that's where you're going to find the soleus. So soleal line, soleus, and you can see that line running in the back right over here. Now, relatively minor and not something that you can really find, but just like the humerus, you have a nutrient foramen, which is going to be near the soleal line, kind of a bit in the middle. Now, looking on the distal side, you'll be able to see a few things as well. So if you look closely, here is your tibia, here is your fibula. Right here, where the tibia and the fibula meet, you'll have a concave region where the fibula kind of like can rest against it. So you'll have like a kind of concave region, and then the fibula will be able to rest inside of that. That is going to be called the fibular notch. But then you also have a little groove in the back over here, which, once again, we'll talk about these more in depth later, but there are tendons of muscle that will be traveling through here, which is going to be quite a few, or like quite a few prominent ones, which will be like the flexor digitorum longus, as well as the tibialis posterior. And then lastly, another good thing to look for that, though, is the medial malleolus. So medial malleolus is going to be a landmark that is really helpful for looking for those tendons. And once again, we'll learn about this, but you have the Tom, Dick, and Nervous Harry structures, which will be right behind it. So it sounds like I said just random names and things, but that will hopefully become important to you in the future. Now, looking at the fibula, I mean, it's a pretty nondescript bone. Like, this is the one that's honestly kind of the toughest for me and many people to be able to identify, just because it's somewhat normal looking. Like, it doesn't really look like a lot of or it doesn't really have a lot of unique things, but you can still see at least a couple. So this actually doesn't show it too well, but you can see that you have two ends of the bone, which are going to be slightly different. And to just start off with, like you have the head of the fibula on one side, And then if you remember, what was this one called? The medial malleolus. So guess what you also have? Lateral malleolus. So lateral malleolus will be on the other side of the ankle, which you can also feel, but then the head of the fibula is going to be like up here, right next to the proximal end of the tibia. Now, I know you probably even didn't think about like how many bones you have in your leg, but this is going to be the lateral one relative to the tibia, which is going to have like that lateral malleolus. Now, looking at the proximal end, so honestly, not very easily, here would be the head of the fibula, and then this right here, kind of along the posterior side is the apex of the head. So this is the apex of the fibula, and something else to helpful or hopefully help with looking for the head is that it will slightly be flat. Like the head of the fibula will be slightly flat, and then the apex is right near the back. So it's not going to be the easiest thing to distinguish, but it's a little bit flatter on the proximal end. But that leads us to the neck of the fibula, as well as in a similar manner, like the borders of the fibula. But in this case, like it's not really the best to be able to find these. The only one that I would say is relatively clear is the medial crest. So the medial crest is going to be right along the medial side, which is going to help with forming like the borders a little bit. So medial crest, you can see right over here, right down this like kind of like thin line. That's somewhat of a good indicator of the anterior as well as medial side of the fibula. But on the distal side, you'll see like first of all the lateral malleolus, so that big bump on the distal end. But then you'll also see the articular facet down here, which is going to be for the talus. And then you'll also see that you have a malleolar fossa. So malleolar fossa is like the fossa kind of on the underside of the malleolus, which is once again kind of important for the ankle joint. And then if you look closely, there will be some room for like tendons as well, which will be down here like on the distal end of the fibula. So those honestly are not very easy to see, but there is mostly the malleolus, its fossa, and then, I mean, a little bit of the articular facet is somewhat visible. Now, lastly, I guess, to just help with orienting yourself a little bit to the fibula, if you look at the lateral malleolus, it looks like it's, I mean, if you don't look closely, it just looks like it's on the distal end, but it does slightly point a little bit posteriorly. So this is going to be the anterior side. This is the posterior side. It is slightly pointed posteriorly. So this is the tougher ones to orient yourself to just because everything is somewhat similar, but try to look for the flat end of the head, maybe even the apex, and then the lateral malleolus is going to be on the posterior side. Now that brings us to one bone that you'll need to know for the ankle. Like this is one of your named tarsal bones. This is called the talus. So the talus is going to be this bone right under the tibia, but you can also see that it does articulate with the fibula a little bit as well. But the talus is going to have like the kind of like groove on the top. So something that might sound a little bit familiar is that it has a trochlear surface. So the trochlear surface is going to be kind of like the trochlea of the humerus. This is going to allow it to kind of like, it's going to be like a groove that helps it to kind of like fit with the overlying like bone. So the talus is going to have like a groove on top, and then the tibia will be able to rest on top of it. So it does have a little bit of like arc or general shape to it. Like it's going to have that trochlea, but also it is a little bit more wide anteriorly, and it does have that like smooth part on the top of the talus. So we'll talk more about the talus later when we go over the osteology of the foot and ankle. But one more thing to look at regarding like, well, not one more thing, there's actually a lot more things, but one thing to look at regarding like the leg bones, very simply, is the interosseous membrane. So just like in the radius and ulna, just like radius and ulna, I guess, we have an interosseous membrane, which means between bones. So this will be the interosseous membrane between the tibia and the fibula. And if you look closely, these fibers are going to be slightly like downward towards the fibula, but then also there are a couple of little spaces that you'll see here as well, which is going to be one, like for an artery to travel through. So if you know, or if you like remember regarding the blood vessels, the posterior tibial artery is going to travel. Well, first of all, the popliteal artery travels along the back of the knee. The posterior tibial artery and anterior tibial artery is going to branch off of that. And the anterior tibial artery is going to travel through here to go to the front of the leg. So the posterior tibial artery continues, but the anterior tibial artery goes through this hole to go to the front of the leg. And then down here, you'll also have another opening, which is going to be where you have these kind of like, well, these smaller blood vessels that come off of the fibular artery. They travel through here as well. So those are a little less, easy to find, but at the very least, you will be able to see the anterior tibial artery up here, which, depending on how we view it, you might be able to see it go through, but we might just see it like on the anterior side of the interosseous membrane. Alrighty, so let's take a look at some kind of specifics of these joints as well, which starting off with up here at the proximal tibiofibular joint. This is the proximal portion of the tibiofibular articulation. So this is like between the two bones, not necessarily like across like the knee, but it's just between tibia and fibula. So this is going to be a synovial joint. It's a diarthrosis, meaning that it can move quite a lot. And although it doesn't seem like it, like the fibula can actually move like around front, or like around to the front slightly, around to the back slightly, and even a little bit upwards and slightly outwards as well. So it does have some like interesting movements, but for the most part, it's just some gliding movements just around the tibia. So looking at this, you do have some ligaments that we're going to be learning. So let's go ahead and start with number one. Like, it is a synovial joint, so it has a joint capsule, but also looking at the front here, you probably can guess this is the anterior ligament of the fibular head. So here's the fibula, or the head of the fibula, and on the front side, like, how can you tell that this is the front side? You have the tibial tuberosity, patellar ligament. That's some good indicators. This is the front of the tibia and fibula, so this is the anterior ligament of the fibular head. So anterior ligament of fibular head is on the front. Guess what's on the back? So over here, you have the posterior ligament of the fibular head. So these are largely just holding it in place, but you also have a bursa in the back of the knee here as well, which is called the popliteal bursa. So the popliteal bursa is relatively deep. It is going to be kind of like under the popliteus tendon, which you can see like cut here. So it doesn't show it super well, but you can see it at least a bit, like over here. Now, regarding blood supply, like we are kind of like still near the knee joints. So we have some of these knee blood vessels that'll be here as well, which will include the inferior lateral genicular artery. So that blood vessel is here along the lateral side of the knee joint. So that's going to be the inferior lateral genicular artery. But then something kind of new, like you also have these anterior tibial recurrent arteries. So you can see that down there, but oh no, maybe you can't see it. So if you look here, you have the anterior tibial artery. That's going to be like here, right here, and then the anterior recurrent or anterior tibial recurrent arteries will be going upwards from that. So another blood vessel that helps to like go around the knee joint will be the anterior tibial recurrent arteries. So look closely at this, and you can see the popliteal artery back here, but then do you see this branching? This is the posterior tibial artery because it's a little bit opaque. And then this one is the anterior tibial artery, which travels through that hole in the interosseous membrane. And then you have these arteries coming off of it, going upwards, or rather going back up the leg. So that's why they're recurrent, but they're coming off of the anterior tibial artery. So hopefully that makes a bit of sense. But let's keep on going to the nerve supply, which once again is kind of on the lateral side. So what nerve is on the lateral side of the leg? That's the common fibular nerve. So common fibular nerve, that'll be somewhat lateral, which is kind of where you see the meeting between the tibia and the fibula. So most centrally, like everything kind of runs behind the tibia, but the fibula is kind of like that little, I don't know, forgotten bone that's going to be slightly on the lateral side. Now, the distal tibiofibular joint is a little different. Like, for the most part, it is going to be kind of similar in like how it's organized, but if you look closely, like it's kind of between an interesting part of the tibia and the fibula. Like the tibia makes sense. You have the fibular notch of the tibia, but then it's mostly attached to like at least for the most part shaft of the fibula. So you can see the fibula here, like kind of near that medial crest, but this is going to be the fibular notch of the tibia that allows it to kind of like rest inside of it. So you have like the notch, and then the fibula can like rest inside of that notch. But this is going to be a synarthrosis, meaning that it does not move a lot. So synarthrosis or syndesmosis, like this one does not move a lot. Like this one should be pretty stable. So in this case, you do not want this to move. So there's some pretty strong ligaments that will help to do that. So first of all, you have an interosseous one. This is going to be kind of between the bones. You don't really see it that much. So this is going to be within here. But then you also have like a couple of ligaments. So the anterior tibiofibular ligament. So this is not like of the fibular head. This is the anterior tibiofibular ligament. And then you'll also have a posterior tibiofibular ligament as well. So I don't know if we have a picture of that. Oh, yeah, we do. So, well, you can see the anterior one pretty clearly, but if you go to the back side, you can see the posterior tibiofibular ligament, at least a little bit. So anterior and posterior tibiofibular ligament, you can see those here and here. And an interesting thing or a clinical thing that is good to know regarding this joint is that this is one of the places where like a lot of ankle sprains can occur. So the high ankle sprain, especially, this is where like these ligaments and this joint that you don't really want to move is going to move. So like in that case, like if you were to damage one of these ligaments, like that could be one of your high ankle sprains. So syndesmosis, synarthrosis, so it does not really want to move. Like diarthrosis, kind of like the proximal one, that one can move a bit, but the distal side, you don't really want to move. Now, thinking about this once again, what nerves are around this? So regarding like the knee, or the distal ankle joint, you have the tibial nerve, which is going along the medial side of the ankle, and then along the anterior side of the ankle, you'll have the deep fibular nerve. So these two are primarily like the deep nerves within the leg and ankle. So tibial nerve on the back, deep fibular nerve on the front. The blood vessels here that are going to be bringing blood to this region, once again, you can kind of see the anterior and posterior tibial arteries. So anterior tibial artery still continues down to the ankle, like before it branches into like dorsalis pedis and everything. This is the anterior tibial artery, which you can see along this distal tibiofibular region. Posterior tibial artery is the same thing, but on the posterior and medial side of the ankle. And then the posterior lateral side of the ankle will be where you have that branch off of posterior tibial artery, which is the fibular artery. So honestly, a little hard to follow because of its like overlying pathways, but you can see this branch coming off of the posterior tibial artery. This is going to be the fibular artery. So kind of like surrounding it, you have on the posterior side, posterior tibial artery and fibular artery. And then on the anterior side, just the anterior tibial artery. And that is at least relatively deep until it gets down to the ankle joint. Now, this is where we get to somewhat newer stuff because you don't know exactly what the talus is too much yet, but this is where we have what's called the talocrural articulation or talocrural joint. So talocrural. Talo is referring to talus. Crural is referring to the leg, and mostly the anterior leg. So we do have another term that we often use for the leg as well, which is sural, which is more specifically like the calf. So talocrural is going to be the ankle joint, essentially. So if you look closely, this is the talus. You can see the trochlea even, and then you have the tibia, which is going to be resting on top of that trochlea, which allows it to have its main axis of movement, which is going to be in the sagittal plane, but that is going to be plantar and dorsiflexion. So it is a diarthrosis. Like you can move your ankle joint quite a lot, but mostly uniaxial, as in like it moves like one direction, but it is also triplanar. So this is a hinge joint, which means that it mostly goes like between like a bone and a singular groove. So like it goes along the groove, which is a hinge joint. So let's go ahead and take a look at that, which if you look closely is slightly angled. Like for the most part, you will see that it is going to have like one singular plane of motion, but it does have a little bit of like angle to it as well. So medial malleolus, lateral malleolus, and then this is going to be the talus kind of in between them. So when you think about the movements, it's mostly in the sagittal plane, which is going to be for dorsiflexion and plantar flexion. And if you recall, I was talking about like what dorsi and plantar are referring to. Dorsi is like the back, but in our case, like when you think about the back of the foot, it's actually like this part, like thinking about a dorsal fin again. This is dorsal, so for the foot, this is the dorsal side. And oh, I can't go much higher with my wrist, but this is dorsiflexion. And then plantar flexion is referring to like the sole of the foot. So that is when you bend your foot downward, which is, well, in this case, plantar flexion, towards the plantar surface. Now to look at these specific parts of this joint, there are going to be like quite a few little ligaments. So we'll kind of break this up, but you can see that you have stuff that is going to be talofibular as well as calcaneofibular. So might as well bring that up now. If you look closely, the talus is going to be right here at the top of the ankle, but at the back and bottom of the ankle, you have another named tarsal bone that will be really prominent, which is called the calcaneus. And you may have heard of this, but the calcaneal tendon is going to be like where you have your Achilles tendon, basically. This is going to be your heel bone where it connects to at the calcaneus. But over here, you have tibiotalar, which makes sense, as well as tibiocalcaneal. And then a couple of different retinacula, which are like flexor and extensor retinacula, but you'll actually have a few more parts to it this time. So looking at this, like there is a joint capsule. It is going to be mostly relatively thin, except for like on the sides. Like the sides are really important. Like that's going to keep like the foot from like disarticulating. Like that's always bad. But like you'll have a joint capsule that surrounds it, but also quite a few ligaments. So Looking at the lateral ligament. So once again, what bone is on the lateral side of the leg? That's the fibula. So the lateral supporting ligaments you can see, you have the anterior talofibular ligament. You can see that right over here. So fibula to talus on the front, anterior talofibular ligament. And guess what? Going along the back, you have the posterior talofibular ligament. But going down from the fibula to the calcaneus, this is the calcaneofibular ligament. So, it's just kind of like three different directions in this case. Like from the lateral malleolus, you'll have an anterior talofibular ligament. From the back of the lateral malleolus, posterior talofibular ligament. And then going downwards towards the heel bone, you have the calcaneofibular ligament. So you'll be able to see those kind of like going along the sides of the ankle here, like all of them basically extending from the lateral malleolus. So one more thing I guess you'll be able to see, like although we don't know about it too much yet, like these two muscles right here are a couple of muscles along the lateral side of the leg. And like what bone is on the lateral side of the leg? The fibula. So these are called fibularis muscles. So you have fibularis longus and brevis, which will be traveling kind of like along or like under, superficial to the calcaneofibular ligament. So this is a relatively deep ligament. You can see that right here. And then these two tendons of those two muscles are going to be running along the top of it. Now, going to the medial side, instead of we're talking about like fibula, in this case, we have tibia. So in this case, we have anterior tibiotalar ligament, posterior tibiotalar ligament, and then once again, you have a tibiocalcaneal ligament, but then you also have one more that goes towards the anterior, like tarsal bones, which are called navicular bones, and there are a few navicular bones. So this is called tibionavicular ligament. So you can actually see them all grouped together here, like posterior tibiocalcaneal, tibionavicular, and then anterior tibiotalar as well. And these are forming something called the deltoid ligament, which deltoid, if you remember what deltoid or delta shape is, it's a triangle. So this is as close as we get to triangles. So you take what you can, but this is going to be a triangle here. So going from the point at the medial malleolus, it then goes down and down to the sides. This is the triangle. So just kind of think about what they connect to. But remember, you have one on the front, one on the back. That's anterior tibiotalar, posterior tibiotalar ligament. And then going downwards from the tibia to the heel bone, tibiocalcaneal, and then one extra one for the medial side, which is tibionavicular ligament. Now that brings us to our retinacula, which is going to be like kind of like a broad connective tissue, kind of like our flexor and extensor retinacula of the wrist. These retinacula will be very similar, but in this case, remember which side of the leg is going to be extensors and flexors. So if you are like in a foot position, the extensors are going to go to the tops of the toes, so they will actually be on the front of the leg. The flexors will connect to the bottom of the toes, so they'll be the flexors. So the extensor retinaculum of the leg will be on the front, right over here, which, if you look closely, has two parts to it. A superior extensor retinaculum, and then also a kind of different extensor retinaculum, which is down here, which is shaped like a Y. So the superior extensor retinaculum is actually pretty similar to what you'd probably expect. It's just like a band that goes across from tibia to fibula. But the inferior extensor retinaculum is a little bit different. And if you look closely, it attaches to the medial side of the plantar aponeurosis. It attaches to the tibia over here at the medial malleolus. And then it also connects over here to, oh, sorry. Oh yeah. So it connects to the calcaneus, sorry. So calcaneus, and then plant or medial side of plantar aponeurosis, and then it connects to the medial malleolus. So it kind of forms like a Y shape, which you can see kind of like its two extensions, and then it's one kind of base at the calcaneus. And as you probably would expect, these retinacula are going to be covering or mostly covering these tendons of like the major muscles, which we'll be talking about very soon. But some things that probably sound familiar, like extensor digitorum and maybe extensor hallucis in this case, but then some that are a little different, like tibialis anterior as well. So looking at the fibular retinacula, so you'll be able to see that you have the fibular retinaculum, which will be superior and inferior. So fibular retinaculum, you can see here as well as here. So a superior fibular retinaculum will be here. Inferior fibular retinaculum will be here. So these two are like connecting to the fibula, which is going to be slightly more lateral. So you can see those here, superior and inferior fibular retinacula. And then over here, you have the flexor retinaculum. Now, flexor retinaculum is mostly posterior, but largely on the medial side. So this is actually going to be covering a lot of structures that we're going to be looking for, which, if you want to like remember this, like mnemonic, Tom, Dick, and Nervous Harry, like that is going to be like a few things grouped together, which are mostly all under the flexor retinaculum. Now, lastly, a couple more things like blood supply and innervation. So blood supply, what blood vessels are going to be here? Now, we haven't talked about these yet, but once again, you have fibular artery, anterior tibial artery, and posterior tibial artery. But you have these malleolar branches that are going to be coming off of them. So these are going to be surrounding the malleoli. Is that a word? Malleoluses. So that's going to be surrounding the ankle joint. So these malleolar arteries will surround like the medial and lateral malleolus, and those branches of these arteries are going to be supplying this part of the ankle joint. So surrounding like the talus, the calcaneus, and then the medial and lateral malleolus, these are the malleolar branches of fibular artery, anterior tibial artery, and posterior tibial artery. And then just to finish up, what nerves are here? I mean, they haven't really changed a whole lot. So along the medial side, part of your Tom, Dick, and Nervous Harry, you have tibial nerve. And then on the lateral and anterior side, a little bit more anteriorly, you have the deep fibular nerve. And then more on the lateral side, you have the superficial fibular nerve. So when we look at those, like you'll see that the superficial fibular nerve kind of like goes around and to the front, but the deep fibular nerve is going to just basically stay in the front. So that's about it for today. If you have any questions, make sure to ask, but otherwise, I'll see you all next time. Good luck with your studying.